Jamal.
Yes, this is Jamal. This is my surrogate son. He's been with me for the last year. He's amazing. He just came from Southern University in New Orleans, where he's going to be an honorary center scholar. There's a new program called named after Russell Honoré.
Sure.
He started a program at Southern for young African American men to get a full scholarship for college, and to also make a commitment after they finish college to either teach or do something in science and technology and continue their educational career as in engineering or something like that. And Jamal's interested in engineering, so he just graduated from Clark High School. He's the first person in his family to graduate from high school. And so he's off. I know a lot of you all know Mary Joseph and Paulette Bailey with the Children's Defense Fund. Tomorrow, well, Monday, the Children's Defense Fund is having their annual conference and convention in Cincinnati, Ohio. They have a program for young leaders, so they're like 1,500 young leaders from across the country that they're gathering. They're having a bus that comes from New Orleans, but all over the country kids are going. And it's a conference to talk about community engagement and young activism for young people. And so he's getting on a bus at midnight tonight to go up to Cincinnati.
Oh, I said airplane. I take that back, Jamal.
No, he's not going to airplane.
I'm sorry about that. I want to raise expectations.
Please don't do that, because then I have to go find a ticket, and I don't have a ticket.
No, that was my bad. My bad. I know where I was talking
He's going to get on the bus with all the other young people. So, anyway, thanks for having me here today. Appreciated the opportunity for Ray to excuse my dress. I've been running errands and things all morning, but I wanted to make sure I couldn't be here this evening, that I just stopped by and to just share with you some of the things that are happening, not just with in the state, but also the Louisiana Democratic Party. So as Wade said, I took over 75 days ago with a new team. I took over after Buddy Leach, who's a former congressman, and you know, the party infrastructure was broken. And there's no question about some of the struggles and challenges that we face, because we don't have that infrastructure in place. And when I say infrastructure, I mean the organizations, and you all know best about organizing. You know, there's no question that labor and community organizations like yours, the couple that are represented here, know best about what it means to be active and engaged, and how to change policy. And I don't see the Democratic Party any different than the labor movement and other community organizations. But that infrastructure didn't exist there. And so we would have not been able to identify candidates, train candidates to run for these offices and challenge Republicans on their flawed policies, because we have been failing at that, building that infrastructure. So that was the first task. And the other thing was the message. Right? There's no clear message coming out of the Democratic Party about what we stand for. And so I've been to Alexandria, Opelousas, Lafayette, Monroe and Shreveport just this week. And just on Wednesday, Morehouse, Madison, Tensas, Concordia, Franklin, Ouachita parishes were all represented. And I'm asking folks to rebuild the party from parish by parish. We have something called Democratic Parish Committees, right? And I'm asking that those parishes, 64 of them, all be stood up. And what does that mean, being stood up? So here in New Orleans, we have an Orleans Parish Democratic Executive Committee. Most times you only hear from them when it's time for campaigns and a candidate election and to endorse someone. And that's not good. The parish committees, which are the infrastructure and backbone of the party, that's what makes the Louisiana State Democratic Party strong. If 64 parishes are actively doing the work of the party. And what is that work? That work is holding issue forums outside of election season, talking about affordable health care and accessible health care, talking about public educational opportunities and protecting the state's investment in public educational opportunities, not diverting it to vouchers, right? Talking about a clean environment or flawed tax policy. You can't just keep giving away money, state money, because you can't meet, if you keep giving it away to corporations that don't need it, like Tom Benson, right? You can't ultimately meet the needs of government, the people of your state. There's some fundamental things that government is supposed to do. Affordable health care, provide for a public education, roads, take care of veterans, take care of the disabled, those that can't help themselves, right? Give a leg up to those that want to be self-sustaining, right? Well, we can't even do that in Louisiana right now, because the governor that we have in place is giving everything away in the form of tax credits, exemptions, and rebates and refunds. Every time a company comes to him, he's like, let him have it. Like they used to say, Frankie and Johnny, let him have it, right? No, we can't keep doing that. He's done that for 5 years. And so we've depleted the state resources, and we can't meet the needs, the fundamental needs of people. You get those economic incentives after you meet the need. And so because we've had these failed, flawed policies, we find ourselves in the position that we're in today. So the point is, we need these parish committees to stand up and talk about all those things that I just talked about all the time, so that people understand the stark difference between what it means to be a Republican over here, what they call the right? But it really is the wrong, right? And to be over here, which are Democrats. There's a line of demarcation that should be very clear to everyone about what we stand for. We have an example of that with the Patients Protection Affordable Care Act, right? And that the governor is saying that he is going to reject billions of dollars being injected, $7.2 billion that could be injected into the state's economies, not just to help patients, which is the priority, and people in need of health care, but also providers and small businesses and hospitals. They all hurt too as a result of him not taking this money. But there's a number that you need to remember. 366,000 people. 366,000 people in Louisiana, probably one of your neighbors, maybe one of you in the room, will go without health insurance if the governor is permitted to ignore the law of the land. And the law of the land is when the Congress acts, we know 10th grade civics, right? The Congress acts, they pass an act, the president signs the bill, he doesn't veto it, he signs it, and then the Supreme Court says that it's constitutional. So why are there still questions 3 years later? Why are they still fighting? It's not about that, it's about President Obama, right? That's the difference. That's the right over here and the wrong over here, right? And so there's a clear line. We have to, the parish committees need to help stand up and make sure people understand the stark difference and the contrast between what we stand for and what we're willing to fight for and what they are fighting for. They're fighting against the president just because. It's personal. Because when you have Mitt Romney offering the same health care policy in Massachusetts, he's the author of this thing. Right. Now he's the author of it, but yet they're against it because it doesn't have anything to do with the policy. It's the person. Right? And so we have to make sure that's what these committees can do. The other thing that they can do is they can educate young people and others, voter education, not just registration, but education. And that's important. Getting into schools, letting our young people know why it is important. Back in the 60s, we didn't have that problem. Back in the 70s, we didn't have that problem because there wasn't representation across the board for our community leaders. We had to fight for those things. But we're not fighting for them anymore. And young people take voting for granted. They don't see the connection between voting and what it means to them in their personal life, right? Opportunity for Jamal to go get a free scholarship. It would not exist but for people fighting, right? And so everything that we say we want has to be backed up through action. So those are some of the things, obviously fundraising, obviously voter education, obviously increasing communication and disseminating the information that we get at the national level is part of my job in Baton Rouge, not to just sit there in a silo of Baton Rouge, but to get this information out to 64 parishes, and then those 64 parishes get it out to all of their constituencies. So let me make it real clear what my ask of you. If you say, Karen, how can I help you rebuild the Democratic Party? And I get that everywhere I go. I want to help you. I want to be with you. Tell me what I can do. The first thing that you can do is understand the leadership and understand the structure of the Orleans Parish Democratic Executive Committee. If we have 64 parish committees, chapters, spokes in the one wheel that are strong, that means we have a strong state Democratic Party. It's that simple. We have vacancies in a lot of the parishes that I mentioned. We have vacancies all across the state. But let's stay right here in Orleans. I need clergy, teachers, other labor organizations and community organizations, young, college Democrats, seniors, veterans, everybody with an interest to be a part of this one entity. We have a lot of meetings that go on in our community all over the place, but everybody's not connected. And if we're going to be strong, we have to have collective action, right? And so taking everybody in this room and having them show up at the Democratic Executive Committee because we have the same goals. And that's another place for you to hold your elected officials, whether it's the governor or someone else, accountable. Just because people get elected doesn't mean that they're leaders. Okay? How many times have you elected and re-elected? I can hear, we can say amen to that. Many a times, right? But here's the thing. We don't call them in often enough. And I'm a public official, but I'm ready. You call me in, ask me about any vote, I'm ready to stand up and be accounted for. I'm not always right. I've made some mistakes, and I'll say that because we're all human and we grow. But you have to, as an organization, party or otherwise, you have to call in these elected officials, not first year and then again 4 years later when it's time for re-election. You have to call them in meetings like this, and you have to say, tell me why you voted that way on the city council. Tell me why you gave that contract away for the sheriff's office, tax assessor, clerk, mayor, everybody, every level, senator, representative. They have to come in throughout their term. If you do it one time, when it's time for re-election, you're only going to get the same thing. And that's the definition of insanity, expecting something different, a different result, right? And doing the same thing. So it would be incumbent upon you as an organization, Wade, to regularly call in elected officials that you might find disappointment in some of the ways they're voting or acting, right? That has to be done regularly. Because I get this, people are very frustrated about some of the votes in the session, particularly the voucher vote. They said, why are Democrats voting for vouchers? I can't answer for them. I can only, their constituents in different parts of the state elected them, some here even. But if you sit at the television or listen to the radio, WWL, WBOK, and you listen and you get mad, but yet you don't take action, you don't call your legislator, you don't call or write or email anyone, then nothing's going to change, right? I tell you what, if somebody sends me a letter or calls me, definitely once, but if it's 2 or 3 times, I know I'm in trouble. And I need to not only call back, but I need to answer for whatever that is. And you can't run away. You certainly can't run away from it. Excuse me, I'm sorry. It's probably just my husband Norm. Don't tell David. Don't tell David.
I got it on tape.
Oh, no, not tape. Don't have that on YouTube. Oh. So let me jump to healthcare. So
his brother's saying he's at the gym.
Well, he did say that when I asked him to do something. I was like, this honey-do list, while I'm gone this morning, I need you to do this. He's like, I'm working out. I don't have time for you to do that. Don't you have your iPad? I was like, I didn't tell him.
Yeah, every time I say him, I'm on the way to sauna.
Exactly, the gym. That's the gym to him. Not working out, but sauna, right? So let me just move on to healthcare briefly. So everybody is fully aware of the Affordable Care Act and the fact that 2 things our governor said within 48 hours after the Supreme Court acted. Number 1, that he was not going to design and help implement the health insurance exchanges. And those exchanges would present the framework for those that are uninsured to have those options and those choices, right? It's going to happen whether the governor does it or not. Either the federal government is going to do it or the state is going to do it. Here's the irony. Governor Jindal usually says, his rhetoric is usually that, I don't want the federal government coming anywhere near Louisiana. That's usually what he says, right? I don't want this money for unemployment. I don't want this high-speed rail. I don't want any federal money, right? That's what he says. Let me tell you what he does. Okay? What he does is that he rejects an opportunity to customize a health insurance exchange program for us here in Louisiana. By doing that, he is inviting the federal government to do it for us. The federal law says you either do it yourself, state of Louisiana and 49 other states, or we do it for you. And so he says, I'm not doing it because I'm not implementing the law. Well, the fact is the default is the federal government that comes and does it for it. So I've been popping him on this because it's hypocritical. Is what it is. He's saying he doesn't want the federal government and it's irresponsible. So that's one thing that he's wrong about. The second thing is that
Thank you, Senator Biden.
the second thing is that he's also said that he's going to reject the money that would be available to take care of that number, 366,000 Louisiana citizens for 3 years, right? From 14 to 15, 16, they would all be covered. 100% of the money, federal dollars, would cover the 366,000 uninsured. That's an approximate number that's been given to us by Congress, Congressional Budget Office or whatever. So 366,000 people, he individually, on his own, has decided that we're not going to accept 100% coverage of 3. So what about these people if they, I mean, this could actually be life or death, right? But he says, I'm not going to take that because after that, there's going to be a requirement that I pay 5% more, 10% contribution. Now, the federal government doesn't go away and say after the 100% for 3 years. They still pay 90 to 95% of the cost for that population. The intent is to make sure that people are insured. You do the health insurance exchange, right? The federal government takes care of it 100% for 3 years so that the states can transition to having coverage for everybody in need. Why is that important? Because right now, what happens is that people who are not covered show up in emergency rooms. They're gonna get care, right? The question is, do you get it preventive care in primary care physicians' offices in our neighborhoods, FQHCs and clinics? Do you do it that way through a typical insurance program, or do you get sick because you don't have insurance and you just go straight to, well, it's much more expensive in the emergency room. And that's where the dish payments come in, whether it's public or private hospital. Those disproportionate, those share dollars that come from the federal government, however, are no longer going to be available because the president's bill, the Congress's bill that passed, says if you do this the way of the Affordable Care Act, then everybody will be insured. So I'm going to reduce the dish payments because you won't have that many people showing up in the emergency room. So by rejecting the money, Governor Jindal is putting us at even greater risk. And the reason is the dish payments from the federal perspective is going to be reduced. Because most other states will have their people on insurance. And they're not doing that policy anymore because it costs more. So they say if you follow this, the law, that the Supreme Court has upheld, then people will be covered and we will move forward. Well, now we got a real problem because you're not going to cover them. Governor Jindal is rejecting the money and the opportunity to have them covered, and the dish payments will be reduced. So the hospitals will not be able to afford to take care of the people that show up in emergency rooms. Y'all follow me? So let me give you something even bigger. So everybody who works pays taxes, and your federal tax dollars, no matter how much it is, go out to Washington. Well, part of the Affordable Care Act and the way that they cover the 100% for 3 years is through federal tax dollars covering it. That's our money. Well, we send it up, and by him rejecting the money, rejecting the opportunity to cover, we don't get it back. So what does that mean? You think they're going to send us a rebate check? No. We get some kind of tax? So Governor Jindal hasn't talked about this. So when he says no to the money, what happens is that money becomes available for people in Texas, for people in New Jersey, for people in Ohio. So they're going to get coverage because many of their governors are not rejecting it.
Well, some of our people are from Texas and they've got a fool as governor too. So.
Yeah, I heard about Rick Perry rejecting it, not for 366. I think that's 1.2 million people, if I'm not mistaken. Is that right? Yeah. So we got a couple of folks that are caught up in politics. Let me tell you, what I really think is going on is that they know with a state like Louisiana that is in such need of health care, at the end of the day, they're going to have to implement it. 2 reasons why. Because President Obama is going to get reelected. Okay? No. When he gets reelected, whether the House, the Congress is still Republican dominated, right? Majority. The Senate is still Democrat. Hopefully we will take the House and keep the Senate, right? But even if, let's say, worst case scenario, President Obama gets reelected and the House and the Senate go Republican, he has the same power that Bobby Jindal has here in Louisiana, veto. So even if they try to send it to him, so here's the point, as soon as he gets reelected, they know that all this rhetoric about not implementing the Affordable Care Act, it all goes away. In November, you're going to hear everybody changing their tune because they can't afford it. Okay? Well, how about this? Wait, should I open it up for questions on specific questions on what you want?
Is there anything on the specific cuts here? I mean, what we're already finding
Oh,
out, just so
okay.
you know,
The 800.
is that on our community home workers and others, they're already being told, you can forget about the increases you had in your contracts,
Sure.
because the reimbursement rate's gonna go down.
Yes.
Staffing's gonna have to go down, everything's going down.
I'm sorry, let me get to
Is
that.
it too late to stop any of that?
Okay, so let me give you the whole story. So I had a conference call with Senator Landrieu earlier this week, I think it was Wednesday. And she wanted to make sure that some of the legislators knew exactly what happened in Washington. So for 3 years, they've been working on the transportation bill, the Restore Act, right? And everybody was promoted. David Vitta sent out a newsletter saying everything was grand with the Restore Act because we got all this money for coastal restoration and the BP fine money's coming back. Well, he forgot one little thing, this provision that cut $650 million for health care. Now, where did this come from? Why did it get done? So after Katrina, the income was inflated for Louisiana because you had all these monies coming in for construction and all the rebuilding efforts. Federal government is dumping all this money to help us rebuild. Well, the way that the federal Medicaid match formula works is so the state puts up a certain amount of state general fund money, and then the federal government matches that money to give us our total Medicaid money budget for the year, right? Well, the federal government, that formula was skewed after Katrina because when all the people left and were gone and displaced, it looked like we were making much more money. It looked like we were making much more money than we were, right? Because there were less people, the income was high, all this money coming in. So Senator Landrieu, in addition to Governor Bobby Jindal, asked the Congress to fix the skewed formula. We said, look, we need some time after a disaster, and some other state may have this experience too in the future. So please fix this formula so that we don't get hurt and harmed by this income problem. So the federal Senator Landrieu put in the Affordable Care Act when it passed 3 years ago. She put in there a provision that would give us more money just for a certain time frame while we got the income level formula right. That make sense? All right, so guess what? Federal government, the staff, they make a mistake in drafting it. A mistake that favored us though. It wasn't too low, it was way too high. Senator Landrieu knew it was too high, Governor Jindal knew it was too high. So we start getting the money, the formula is now skewed to our benefit, right? But they don't catch the mistake until about a year, right, until afterwards. So they negotiated a time frame to fix the problem, right? So we're getting our money, no problems. Governor Jindal's spending all this Medicaid money, the whole time, spending all the Medicaid money. Using it after the stimulus money went away, he's using it all to balance the state budget. I'm watching him every year. Spend, spend, spend. Say one thing, spend, spend, spend. All right, no problem. Well, this year, with this Restore Transportation Bill, which passed, right? 3 days out, the Republican House, the GOP House, decides that they need more money for the transportation bill. And of course, their way of doing it is not to cut tax credits or exemptions for the 1%. It's to come and find money. One of the places was in Louisiana. Y'all remember this is what they say. Y'all remember y'all have that problem? We shouldn't be giving Louisiana all that money. That was a mistake. Y'all know it was a mistake. Give us that $1.2 billion back. Well, Senator Landrieu's like, wait a minute. I thought we had an agreement, we had a timetable that we were gonna fix this. Well, no, we need to do it now, right? So they fought. Senator Landrieu in the U.S. Senate said no when they were doing the conference committee. Guess who's on the conference committee, by the way? David Vitta. He's the only person from Louisiana on the conference committee, right? Senator Vitta doesn't say anything.
What?
As I understand it. He's on the, you know what it means to be on the conference committee. When the House has a dispute and the Senate has a dispute, they get a couple people from the House and the Senate and they get together, they call it a conference committee, and they resolve the dispute. Well, the Senate, initially, I'm not going to say that. Let me take that back. I don't know if he didn't say anything. That's not a fair statement.
But you know what it was, Vanessa? He was busy with a call.
Uh-oh. Yikes. Yikes.
This is our meeting, you know, we keep it important.
So So Senator Landrieu stops it, they go back to the House and say, we are not accepting this over $1 billion hit to Louisiana. It's not happening. Senator Landrieu stands up. Well, they go back and they come back with the day the bill is going to pass, that Friday, 2 weeks ago Friday. And they say, we're going to include $650 million. Now, Senator Landrieu, for the previous 2 days, has been calling Governor Jindal's office, speaking to Paul Rainwater, speaking to Greenstein. Her office begged them to have Governor Jindal call Speaker Boehner, John Boehner, who's the Speaker of the House in Washington, and say, please call the House Republicans and tell them to stop. Do you understand what this is going to mean? It's not just $650 million. It's really $859 million when you take the state match money. So that's the impact. You don't want this to happen. She calls Steve Scalise, Congressman Scalise. She calls Congressman Richmond. She calls Congressman Cassidy. Calls all that. Y'all need to stop. I'm not in the House. Get the House Republicans to stop this. This is going to hurt Louisiana. Governor never makes the call. Refuses to make, he's on the road with Romney. This is only 2 weeks ago. He refuses to make the call. And on Friday, Thursday of this week, they had a hearing in Baton Rouge that I went to. And we were asking Secretary Greenstein, look, did you talk to the governor about these cuts before it was happening? Didn't you know from Senator Landrieu? He says he knew. And he says that they have no intention, the governor, as he knows it, the governor didn't call, and they have no intention on asking the federal government to help. Exactly. So, that is what transpired. So the bill passes. Now, every member of the Louisiana delegation voted for the bill because there was this transportation stuff associated with it. And Senator Landrieu did not have the ability to stop the GOP House. It was a negotiated bill, and Senator Vitter was at the table. He was the only one from Louisiana at the table. Now, he didn't stop it. And Governor Jindal didn't make the call, right? So now we have, as of the last 2 weeks, $859 million cut. So the governor announced 1 week later what the cuts will be. Yes, providers will get a significant, they already got a cut. They already got rate decreases, gotten slashed. They're going to continue to get cut. Hospitals will probably close. When I was in Monroe on Wednesday, I was told by somebody inside that every charity hospital, with the exception of Shreveport and New Orleans, would be closed. Now, the reason this was not talked about on Thursday at the hearing is because the governor's office did not permit Fred Cerise to come and testify. Fred Cerise is the vice president for the LSU charity system. He is the one that's most knowledgeable. He worked under Governor Blanco as DHH secretary. There's a little bit of a rift there between the Jindalites and him. So the Jindal administration presented Bobby Yarbrough, who's a member of the Board of Supervisors for LSU, and William Jenkins, who's the interim chancellor, who just came back like 3 weeks ago, that Jindal hired and LSU folks hired. But they're keeping the experts, the healthcare experts, away from the legislators so that they can't tell us what the truth is. And I'm telling you what the truth is. The truth is that when you have to take a 75% cut in the dish dollars, and they don't have to put all the cuts on LSU. If you look at the percentage of cuts on the LSU hospital system, it's disproportionately toward LSU rather than DHH's budget, the administration budget. So, what does that mean? As I understand it, significant cuts, for example, foster care children who need health care, who get the subsidy, going away. Hospices, support, going away. No, this is one of the most devastating things I've ever seen in my 12-year term. I've never seen anything this significant in 12 years of service, and I've never seen the callous disregard for human life that this governor has. And to be traveling, you tell everybody you got the job you want. I got the job I want. I don't want to be vice president. But everything you do, you're always traveling, and we got a major healthcare crisis going on in Louisiana, and you know where to be found. Right? Monday, 2 days from now, the Joint Budget Committee meeting is meeting at 10 a.m. in Baton Rouge. Activism would be, if you can, to be there. To be there. And to be there having your voice heard by presence. The House and Senate members of that committee are the ones that have the ability to either embrace the cuts or to fight them. That is the key committee. They are the budget committee when we're not in session, joint budget committee. And it's made up of the president of the Senate is there, the House Speaker is there, and a number of key leaders. I used to be on that committee. For some reason, Governor Jindal didn't want me back there, so he told the president, don't appoint me. Right? But I used to serve on House Appropriations, and then when I moved to the Senate, I was on Senate Finance. Joel Chasson appointed me there. But I think the kind of questions that I was always asking kind of frustrated people sometimes. So he doesn't like to have people challenge his position. And so I would always, interrogate, use some of those legal skills and interrogate some of his compadres, and he didn't like that very much. So I didn't get back on that committee. But it doesn't stop me from issuing press releases and popping him appropriately for flawed, policies and stuff. So the significance for all of you is that there are going to be mass layoffs, okay? Mass layoffs across every field, every area of healthcare. It doesn't matter what area you work in. If you are any way affiliated with a Medicaid reimbursement or a Medicaid subsidy, you're going to be hit, right? Some more severe than others. It is my opinion that his intent is to privatize, ultimately to privatize the system. So the law says that he can't, administration on its own can't close a hospital. But what they can do is they can cut up to 35% in a fiscal year. Well, these cuts equate to 25%. But notice he didn't do the entire amount. There's still 93 million. He announced, what it was, he announced whatever that number is that he announced last week. There's still 93 million in cuts to be, and he's saying that, when I say he, the governor is saying, I think that we're going to have more revenue coming into the state. And I'm going to wait to see for this more. Well, corporate income has been down for the last 3 years, even though he says that he's doing economic development and creating jobs. Personal income has been down. And so the revenues have been down because of all these exemptions and tax credits. If you have less people, not really people, the people are paying, but less companies paying taxes because you give them all these tax breaks, then you're not going to collect as much. That's not going to change. What we foresee is additional cuts later in the year, in addition to what we've already heard. And that's not a healthcare crisis, which Secretary Greenstein actually said at the table. I wasn't at the table, I was over on the side, but everybody looked at me. He said, somebody asked him, do you think that we have a crisis? And he said, no, I wouldn't call this a crisis. Oh my God, you should have heard me. I'm over there. I didn't even have a mic, but everybody in the room heard me. I was like, are you kidding me? This is not a crisis. What is your definition of a crisis? So, and maybe that's what you need. Like, yes, it's a crisis, signs or something like this, FYI, 859 million equals crisis. But, what can we do? Here's the thing. What can we do? The federal government, and on the conference call with Senator Landry, the federal government, there's really nothing else that they can do. The thing to do would have been to stop the amendment in the bill, right? Yeah. There's only one more bill that should be even an opportunity to do something for the end of this congressional term, which is, and Senator Landry said it's like a defense bill. But the problem is we have a Republican-dominated House that they're the ones that put the amendment in the first place. Unless you change their mind, the only way to change their mind is to have a Republican convince them, like Jindal, like Vitter, like Scalise, convince them to change their mind. But it was that's why I gave you all that history. It was a mistake. It was a miscalculation. We weren't owed the money anyway. And Jindal, Mary, everybody acknowledges that. So I just want you to have history when you're hearing about this. Yeah. It's kind of hard to go ask the federal government for something that we didn't deserve anyway. Right. It was only a matter to be phased. It was going to be phased out anyway. So here's the thing. It was a matter of when they did it. And they had told us that we were going to have it for this fiscal year, and then we could not count on it anymore. So they just kind of changed the game in the middle. So the answer to federal help is unlikely. So I always jump to solutions. What can we do? I say, look, tobacco tax. Yeah. We've been trying to pass a tobacco tax and 78% of the people in the state agree with the tobacco tax to dedicate it to health care, right? Yeah. Now, nobody's messing with choice. Everybody thinks, nobody's telling you can't smoke if you can't smoke. I'm telling you that it's not a good idea. Just because I've seen people, my grandmother died of lung cancer, my dad used to smoke, I got too many people that I've seen, and you shouldn't be doing it. It's just not good for your health, and if you want to be around, stop smoking. All right, now that's my preaching for today. Well, not really. I'll preach some more at some other point. And it's a waste of money. Okay? You can't afford it, and it's not good for your health. You're killing yourself, and you're going to cost yourself and your family money along the way. So stop it. But if you choose to do it, you need to pay for your own health care. If you choose to do it, don't make me pay for your bad habits. Okay? Pay for your own health care. So my position is, I'm ready to increase tobacco tax to cover the cost of health care for those people that are causing the health care to go up that keep smoking.
Right.
Right? 78% of the people in Louisiana agree with that. So two, namely Republican governors, Charlie Crist from Florida, when he was governor of Florida, increased the tobacco tax. Haley Barbour, right next door from Mississippi, increased the tobacco tax. Those are two Republican governors, right, that increased the tax and dedicated the money to health care. Well, our governor, which we tried to do, said no. He said, our tobacco tax is like 33 cents or something like that. Everybody across the country who wants to smoke might as well come here and buy their cigarettes because it's very, very low. It's very, very low. And so it's nonsensical. So that's one potential, not complete solution, but certainly can contribute to the healthcare needs. The other one is to cut some of these corporate income tax credits, exemptions, and rebates. There's something that starts on Monday. Another committee, this is why Monday is very important. If you want to do something and show up, Monday is important. At 2 o'clock, the Donahue Commission. Jack Donahue is a state senator from the North Shore. He's a businessman. He owns Donahue Construction, but he serves as the chairman of the Finance Committee. Okay? He is well aware that some of these tax credits are not producing, the incentives are not producing the jobs that Governor Jindal and others said that it would. So this guy, Stephen Moray, who serves as the Secretary of the Department of Economic Development under Jindal, they're all going to have to be on point and answer questions about what jobs have been produced from all these economic development incentives. It's called the Donahue Commission. It starts Monday, and the intent is to see which one of those can be rolled back, which would ultimately increase revenue. So if you're giving somebody a $50 million tax credit, and they said that they were going to create 4,000 jobs, and then we do the analysis, and they only created 500, then why should they keep getting the $50 million tax credit, right? So we're gonna analyze. The commission's job is to analyze all of these things and then decide which one of those, make recommendations to the full legislature, which should be rolled back, which will ultimately, if we pass those recommendations into law, will increase revenues, which means we'd have more money for health care, in addition to higher education and other places that have been cut repeatedly, or maybe teacher pay raises, which we haven't done in like 3-4 years, right? So that's all Monday. 10 o'clock joint budget to deal with health care specifically. 2 o'clock Donahue Commission. But when I tell you that, because I've been traveling for the party, that it's interesting to run into Republicans from all across the state, and they're in my ear, Karen, what are we going to do? Somebody even asked me, well, are you going to talk to the president? I was like, well, I'm going to see him Wednesday because he's coming to New Orleans, but let me explain something to you. And I gave him this story. I was like, well, why didn't the Republicans call the House? The president didn't do this. The president was not for this. In fact, he didn't encourage the Republicans to cut this. He was not worried about this. This wasn't his way of doing it. Y'all did this. And now you want the federal government to save us? No, that's what I said. I think we need to find a state solution. And that's what, it's our responsibility, honestly, as state legislators and the governor, if he would stay home for a minute, to find a solution to a state problem. So that's where we are. Let me open it up to a few questions, and yes, sir.
This is coming from a guy from Texas, where we have, we've given the country George Bush and Rick Perry.
Thank you very much.
My question is a political one. You're a leader of the political Democratic Party here in the state. Is there a future sometime that we may actually elect a governor that cares about?
Mark my words. We will take the nation back.
Our plan in Texas is to just hope we register, Hispanics in the next 20 years.
I don't live on hopes and prayers.
Yeah.
I live on.
So is there a plan?
Yes, there is, and that's part of the work that I'm doing. I mean, I didn't give you the whole. That's why I'm moving around the state. I'm spending at least 40 to 50% of my time trying to rebuild this party. And this infrastructure means something, because what does it mean? I work backwards. That's the date I work backwards from. 2015 is the goal. We know how important it is to have a governor in the state of Louisiana, right? There are several people across the state, and you will hear more from them soon, 3.5 years out to that election. We got time. The good thing is we have time, but we can't wait till 3 months before the election and say, oh, who's gonna run? Last time we didn't have anybody, and we didn't recruit them, and we didn't have them ready and well-financed. We're not gonna have that problem. So this is it. 15 is the goal. We want to take the mansion back because we know how important it is. Veto authority. I can go through. Let me give you the bill that he vetoed. Equal pay for women. Just a task force. I couldn't pass the bill to make it law. I said, let's set up a task force. He vetoed that. We can't even sit and have a conversation about women who get paid 60-some cents on the dollar to men in Louisiana, one of the worst in the country. He vetoes a bill to create a task force. That's how nice. Vetoes a bill to create a school facilities authority to help facilities at public schools. Vetoes that. Vetoes a bill to give rebates to people who invest in public schools, but kept the bill, didn't veto the bill, to give money to the voucher. Okay? Vetoes all this stuff. So that's how important I get it. That's why I'm so passionate. Because he's a joke. He's a fraud. He's a hypocrite. Right? We can't afford, it's just like when we got rid of George Bush, we can't afford to have anyone like, Jindal can't run. We can't afford to have anyone like him in office. Okay? So 15. But before you get to 15, you got to get to 14. Mary Landrieu is going to be running for re-election now. If we don't win the re-election of Mary Landrieu, who's the senior senator, right? We have no chance to win 15 because we will then have 2 Republican U.S. senators. They will think that they have won. They will be popping champagne, right? So 2015, you got to start with 14. And before we get to 14, that is my opinion, and then we should also have other congressional challengers in all these other congressional seats where it's possible, and there are several, and we're going to be ready for that. In 2013, which is only what, next year, we're going to have a Democratic Party state convention. We haven't had this in like 10, 15 years, probably 15 years. And we're going to bring this infrastructure that I talked about, we're going to bring that together. So I need all of the all the constituency groups that make up our big tent as a party to come together and to hear from the potential people that might be that candidate. We need to be solidly behind one person to challenge the multiple Republicans that will be running. There's, there's rumor that Vitter might run for governor, Jay Darden may run for governor, one of the congressmen may run, John Kennedy may run. There are a lot of Republicans that are talking about Mike Strain, who's the Commissioner of Agriculture, Gerald Long, who's a senator. I hope they have 17 of them because we're going to have one, solid one. I'm going to have teachers on the front line. I think they're the most ticked off. They know I'm going to have them right on the front line. And then we got so much ammunition. If you use the constituencies that unfortunately have been hurt by these policies, you have to act on it though. And we have to keep building the organizational structure. So you don't worry about that. I mean, you call me back. I'll give you my cell phone. If you hear that we don't have...
You can worry about Texas, huh?
Right. Anybody else have anything?
A couple of questions. Comment. You talked about some solutions about eliminating revenue from these corporations that are getting tax credits and doing a tobacco tax. If you are able to do that, I mean, the governor has to sign off on it. If we're able to do it, what kind of effect would it have on the situation as far as these healthcare cuts?
Yeah, that's
coming out of the pipes right now.
Right. So it would be my opinion, and when I authored a bill when I was in the House to increase the tobacco tax, right? The way that the legislation was drafted was that the money would go to healthcare, specifically for Medicaid, to meet the match, right? So the match has already been, the formula is what got reduced at the federal level. So that's the same. You can't change the formula. But if you put up more state dollars, right, which we don't have the general fund dollars is the problem. If we identify more general fund dollars, we would have some success. But we don't have the general fund dollars. So we have to find a state solution. And those are two separate things, right, that I'm suggesting that we look at because it's doable. Now, the answer to your question about Governor Jindal, I'm not going to tell you right now that he wouldn't veto either one of those. He's already said that whatever comes out of this Donahue Commission, before it even gets started, check this out, before it even gets started at 2 o'clock, first meeting on Monday, he said, if there's a recommendation from the commission that's not revenue neutral, I'm not going to be for it. Now, what does that mean? Revenue, he signed the Norquist, the Norquist pledge, which says that no new taxes. And he equates a reduction of a tax credit or exemption as a new tax. So it's not just, so he's not going to be for tobacco tax. I'll tell you right now, he wasn't for it before. We had to do a constitutional amendment just to renew 4 cents. Not a new tax. He said he said that if we tried to renew the 4 cents, that was a new tax. We were like, but it's already in place. We're just renewing. He said, no, that's a new. Well, I'm not for any taxes. So we had to come back and we had to do a number on him and put it in a constitutional amendment because he can't veto a constitutional amendment, right? So we may have to be creative again. Look for that kind of stuff. That he's something that's like that. But you shouldn't. As a policymaker, you shouldn't have to put stuff in the Constitution. That kind of stuff should be statutory. Your Constitution is a living document that should be in place. I mean, like the Farm Bill, there very seldom should you change a Constitution. But he forces us to do all kind of stuff to get around his nonsense.
We're gonna wanna meet with Karen again.
Yeah, call me back, whenever.
So, she promised me 15 minutes, it's been an hour. So I'm one more question, I'm gonna let her run, because then she'll never meet with us again.
No, I'll come back whenever.
They say, oh, well, hey, I don't have that much time, you know?
I put Jamal up. Jamal will tell this person.
Okay, there's one
I have
more.
a question, but I sure miss you all for that disaster program.
I'm still on it. I'm not the chair.
Oh.
No, they didn't give me that either. They threw me off of everything.
That's why she had to go to the Democratic Party, she got to kick butt. Okay, thank you.
Yeah, next